We begin tonight with the coronavirus outbreak here in the U.S. and around the world. Tonight, the World Health Organization now declaring it a global pandemic, citing the alarming levels of spread, but also the alarming levels of inaction, in their words. President Trump is set to address the nation tonight from the Oval Office. The death toll rising here in the U.S. to at least 36, 3 deaths just today.
It's hard to believe it's been 3 years since the World Health Organization declared COVID-19 a worldwide pandemic. And as we look ahead, we want to welcome back someone who has helped us make sense of this virus over the years, Dr. Rich Besser, President and CEO of the Robert Wood Johnson Foundation. So happy to have you on this morning, Dr. Besser. It is hard to believe it's been 3 years. Obviously, we've come a long way, but give us your assessment about where we are at this point.
Yeah, Martha, it's absolutely impossible for me to believe it's been 3 years. Time feels compressed. At the beginning of this pandemic, when you talk to infectious disease experts, a lot of predictions were that it would take at least 3 years to have a safe and effective vaccine. Yet the scientific community delivered one within 1 year. And while we lost more than 1 million people in the United States, millions more around the world from this pandemic, estimates are that over 3 million lives were saved in the United States alone from that vaccine. So as we are starting to emerge from this pandemic, there are things that we will never recover from, and there are things that we need to learn from.
And the administration has announced that the public health emergency will be lifted on May 11th. What does that really mean?
Yeah, so when a pandemic is declared, and that's declared by the World Health Organization, it's a statement that we are, in a sense, we are in a global emergency. We are being overwhelmed by a new infectious agent. What we're saying now, and what the government will be saying here in May, is not that COVID is over, not that there won't continue to be transmission, but the emergency status of that has changed so that our healthcare system can handle patients with this. COVID becomes another one of the infectious agents that we deal with all of the time, and we're able to step back and say, okay, the emergency powers, the emergency situation of this has ended. It doesn't mean that we don't need to continue to provide for people what they need to stay safe, to stay healthy. But the way that's done becomes part of how we handle all of the other infections that we face every day.
And Rich, you talk about things we need to learn, things we need to look at, and I'm thinking about long COVID. 23 million Americans are still suffering, as many as 23 million Americans. What progress has been made in understanding that, and what do we do about it in terms of treatment?
Yeah, with any new infectious agent, what we don't know far exceeds what we do know. And what we're seeing with this infection, like quite a number of other infections, is that some people respond differently. And here there are millions of people in our country who have symptoms that don't go away right after the infection. Most people, thankfully, after they have COVID, they recover fully and get back to their lives. But there are millions of people whose symptoms continue, people who are unable to have the energy to go to work or to exercise, people who continue to have difficulty breathing. There's $1 billion in resources at the National Institutes of Health that are studying that, trying to understand what are some of the triggers for this, what are the causes, is it an immune reaction, is it a direct effect from the infection itself, and most importantly, what can be done to help people recover from this. So there are drug trials underway, there are other approaches that are being taken to this, and hopefully the scientific community, the medical community will be able to help all of these people who have symptoms that have persisted get back to their normal lives.
And Dr. Besser, how prepared are we for any future pandemics, any future virus?
Yeah, this is one of my biggest concerns, Martha, that we're not going to learn. I led preparedness and response at the CDC for 4 years. And what you tend to see after any major public health crisis is fatigue. And so our legislators, instead of enacting what needs to take place so that we're in better shape, spend most of their time figuring out who they want to blame for things that didn't go well. And there's a lot of room for blame to go around, but here there's a number of things that need to change. We learned during the pandemic that if you give everyone health insurance, they do better. And now as the public health emergency is ending, a lot of people who had health insurance are seeing that go away. A lot of people who had extra money for food are seeing that go away. A lot of people who had free access to COVID testing are seeing that go away. These are things that we need to change if we want to do better.
Well, thanks for that wisdom this morning, Dr. Besser. Always great to see you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.